Montana is one of only 5 states in the U.S. and the only one in the West where firefighters are not offered care and protection for cancer and other diseases that they encounter while keeping us safe.
While the Senate is on board, the Montana Firefighters Association hopes lawmakers will take up the cause in the House. SB 160 would provide workers' compensation to firefighters who are increasingly at risk from hazardous materials they encounter every day.
We've been working on this bill for 15 to 20 years, trying to get our firefighters covered from occupational disease, be it cardiac, lung, and 12 different kinds of cancers that are listed in this bill. It's now the #1 killer of firefighters nationwide, cancers. It's surpassed cardiac and trauma. We're going through the work comp program because we believe this is definitely a work-related injury.
At the same time, firefighters have been working to expand coverage. There's mounting evidence of often fatal diseases they're exposed to on the job. In fact, when the Montana fire chiefs met in Missoula last year, establishing best practices after fire calls was one of the major topics for discussion. While departments large and small are adapting tighter protocols to cut the risk of cancer and other exposure, there are still many firefighters who have already been exposed or need treatment. And the point was driven home this winter by the untimely death of Great Falls firefighter Jason Baker, who campaigned valiantly for expanded coverage for 2 years after he was diagnosed with cancer.
It speaks volumes to what we're doing here in Helena, and we hope and pray that no one else has to go through this. And it's really too bad that family had to go through that process without any support from the state.
Members of the House Business and Labor Committee will take testimony on the bill starting at 8:30 tomorrow morning. The Firemen's Association is encouraging people to contact their representatives and urge support for the measure.